When the Health Secretary ordered the downgrading of A&E and maternity services at Lewisham Hospital in South London, local people fought back.
Save Lewisham Hospital!
The planned cuts were part of a reorganisation to tackle the huge debts of another hospital trust nearby. The campaigners took the government to court and won. The Health Secretary had overreached his powers. The government's response has been to draft new legislation to allow it to do what it tried to at Lewisham.
It can only be used where hospitals are seriously failing and are putting patients' lives at risk. And what the current government is doing is making sure that we get better patient involvement, better consultation with local staff and better consultation with the local NHS in making these decisions. It will lead to a better regime, but one that still protects patients' lives.
If a trust fails and goes into administration, the administrator can recommend that the Health Secretary shut departments or even the whole hospital. But the new law would also give that administrator the power to recommend that services at neighbouring hospitals are moved into the failed one to make it viable again, and those neighbouring trusts could even be closed down, despite performing well, as part of an overall solution for an area. Tonight, this Lib Dem former health minister hopes to lead a Commons rebellion against those plans.
The decisions should be made by the GP-led commissioners of health services, and they should be subject to proper public consultation. This process will drive a coach and horses through that. It will mean that even when a hospital has not failed, it could be subject to changes over the heads of local GPs and over the heads of the local population.
The government insists intervening to reorganise things would be a last-ditch measure. Ministers would much rather that hospitals, GPs and local people took the decisions.
Not every local hospital can have every service, and we need to find a way of being able to resolve that in local circumstances without having to resort to this sort of administration process. But in the end, where everything else has been tried and failed, we need something like this process in order to resolve these situations.
The fight over the future of Lewisham Hospital showed just how hard it can be to reorganise local health provision. But across the country, there are many more places where tough decisions about hospital services need to be taken.